Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, we're going to cover a fun topic, a very common topic. That is the side stitch. The side stitch, also called the side cramp or the abdominal cramp. In medical terminology, it's called exercise-related transient abdominal pain. Now, the reason I say that it's a fun topic, because first of all, it's so common. It's something all of us have experienced at least one time or another. It's not an injury, it's not an illness, but it is a frustrating condition that occurs all of the time. So I want to go over this, talk about it, explain to everyone what exactly the side stitch is. First of all, in exercise science, the exact cause of the side stitch has not been determined yet. Okay, but I'm going to talk about the theories, what is in the research, and I'm going to also talk about what I have found through myself and speaking with my patients and other athletes to see what they have experienced and what they have done. First of all, the number one theory that most people believe is the cause of the side stitch is there is some type of spasm in the diaphragm or in the ligaments that attach the diaphragm to the internal organs. So we know that the diaphragm plays a major role. Also, the intercostal muscles, which are the muscles located in between the ribs, may be contributing factors, as may be the serratus anterior muscles, which start at the ribs and attach to the shoulder blades. So those are three of the major muscles that may be contributing factors. Obviously, like I said, the number one theory that most people think is that the diaphragm, it is a spasm of the diaphragm or a spasm of the ligaments that attach the diaphragm to the internal organs. The side stitch, again, in medical terminology, is called exercise-related transient abdominal pain, or ETAP. This is definitely preventable condition, and it's definitely a manageable condition. Now, I want to speak about the anatomy a little bit. I've mentioned the diaphragm. Some people don't know what the diaphragm is. The diaphragm is a dome-shaped muscular sheath. It's located in the lower aspect of the rib cage, and it separates the chest cavity from the abdominal cavity. It is the primary breathing muscle. When the diaphragm contracts, it moves downwards, and we inhale. When the diaphragm relaxes, it moves upwards, and we exhale. The other muscles that I mentioned, the intercostal muscles, these muscles are located in between the ribs. They contract and they relax to expand and retract the rib cage. And then the serratus anterior muscles, these muscles are located, they originate on the first 8 or 9 ribs. They go back along the ribs, along the back part of the ribs in front of the shoulder blade, and they attach to the medial or inside border of the shoulder blade. So those are some of the muscles that I'm going to be talking about today. So I wanted to go over that anatomy so you have a better understanding of this condition. The symptoms of the side stitch are a sharp, stabbing pain underneath the rib cage. It can happen on either side. It's more common on the right-hand side. It can happen to athletes of all ages, all levels, and all sports. It is most common in runners, swimmers, and horseback riders. It is also less common in older athletes than in younger athletes. Like I said, it's a little bit more, it's more common on the right-hand side than on the left-hand side. It is also a condition that it's not gender biased. It happens in men and women, and the BMI or body mass index does not seem to be a factor in this development of the side stitch. The side stitch is more common in lesser conditioned athletes and in newer athletes, or in someone who is restarting an exercise program. So they may have been deconditioned from not training and they get out and try to do a little bit too much too soon. Now I'm going to go over some of the contributing factors, and that is going to help you understand a little bit more as to what you can do to help to prevent this condition. Also, when we speak about the symptoms of the side stitch, two things that I also wanted to mention. Usually when the side stitch occurs, there may be pain in the same side of the shoulder. So if you get in the stitch on the right hand side, you may feel some symptoms in that right shoulder. Also, the occurrence of the side stitch is more common when we are running downhill as compared to running on a level surface or running uphill. The contributing factors of the side stitch that I'm going to go over on this video are fitness level, core strength, breathing practices, inadequate warm-up, nerve impingement, running spinal posture, and pre-exercise nutrition. Now, most likely the side stitch is a combination of one or more of these, but I'm going to target each one of those 7 factors and speak about them and give you some information as to what you can do to lessen the contributing factor, lessen the impact of this contributing factor, so that you are lowering the possibility of getting the side stitch. Now again, remember, like I said in the very beginning, exercise science has not determined what the exact cause of the stitch is. But what I have read and what I have seen and talked to patients and heard from patients and athletes, that these are things that you can do to help yourself. When we speak about fitness level as a contributing factor to the side stitch, you have to remember that greater conditioned athletes can stay in normal breathing longer than lesser conditioned athletes. Now, what does that mean? I explained before how the diaphragm works. When the diaphragm is contracting, it moves downwards. When the diaphragm is relaxing, it moves upwards. This is the normal breathing pattern. This is the pattern that greater conditioned athletes can stay in longer than lesser conditioned athletes. When we go into heavy breathing is when the rib cage expands. We are using the intercostal muscles more and all of the accessory breathing muscles more. So that fatigues the intercostal muscles and the other accessory breathing muscles quicker. So that can contribute to the side stitch. So as a general rule, in most cases, as we improve our conditioning, the side stitch should occur less. Now, I had also mentioned that if someone took a break and their conditioning went down a little bit and they came back and they tried to start at the training intensity level that they were at before they stopped, the side stitch may start to occur. They have to start at their current fitness level and build up from there. They have to start at the level they are currently at and progress in gradual intensity increments. That is going to help them to prevent the side stitch and also help them in their training overall. Another of the contributing factors to the side stitch that I mentioned is core strength. Now, a lot of people, you think about the core, they just think about the rectus abdominis muscles, but you have to think about the core overall and how it can affect you while running and how it can contribute to the side stitch. First of all, the diaphragm is a core muscle. It is one of the superior edges of the core. The diaphragm contracts, it goes downwards, the diaphragm relaxes, it comes upwards. So we can do breathing exercises to strengthen the lungs and strengthen the diaphragm. You can do exercises where you are blowing into balloons. It's going to help to strengthen the lungs and the diaphragm. You can do breathing exercises in the pool where you're holding your breath. Different exercises like that will help you a great deal. Also, doing short bursts of high intensity training will help to strengthen the breathing muscles, especially the diaphragm. When we are doing that, the short bursts of high intensity training, it will strengthen the diaphragm because you're going to have to breathe heavy while you're doing that, but you need to work hard to stay in the normal breathing as long as possible. So it's going to help to strengthen the diaphragm and the accessory breathing muscles. So you want to increase your conditioning and you want to strengthen the diaphragm and strengthen all the other core muscles. Now, one thing that I had heard this from a patient a long time ago, and he used this tip to help himself to combat the side stitch. He had done advanced abdominal training. He had a very strong core, very well developed, and he started to do his abdominal exercises in the vertical position, either hanging from a chin-up bar or in a captain's chair. And if you think about this, this is the position that we're at when we're running. We're standing, obviously, when we're running. When you are in the vertical position, when you're doing your abdominal exercises, the internal organs are pulling down on the diaphragm, just like happens when we're running. So if you are someone who can progress to that point, you obviously don't want to start doing the vertical abdominal exercises first. You have to build up to it. But you can do exercises like straight leg raises, bent knee raises, bent knee twists. You can do them while holding a fit ball, do them while hanging from the pull-up bar, or do them in the captain's chair. And this may help you to develop the core strength that you need to help to combat the side stitch. So strengthen your diaphragm. That will help a great deal. Strengthen the breathing muscles. And if you can, do abdominal exercises in the vertical position. The next contributing factor I want to speak about is breathing practices. When we think about when we run, you have to have good breathing practices. Now, I'm going to go over just a couple things that may help you to combat the side stitch. First of all, a side stitch is more common on the right-hand side. The liver is the heaviest organ that we have, and it is located on the right-hand side. So many people have been able to combat the side stitch by exhaling when their left foot hits the ground. This is a breathing pattern that they practice. As you think about it, if the diaphragm, when we are exhaling, the diaphragm is raised up. And so we want to exhale when we are stepping down with the left foot. So that helps to take the pressure, the amount of pull off, it helps to lessen the amount of pull that the liver is causing on the diaphragm. Because if we're stepping down with the right foot, the pull is going to be even greater. If we're breathing out when our right foot hits, the amount of pull can be even greater on the diaphragm. So try breathing out when your left foot hits the ground. Also, try exhaling on the opposite when the opposite foot hits the ground of the side stitch. We already talked about that. If you have the pain over here, you can exhale when the left foot hits the ground. If you have pain on the left-hand side, if you're getting a side stitch on the left-hand side, then exhale when the right foot hits the ground. Also, you can breathe, especially exhaling through pursed lips. Instead of keep the lips closed, just open them very, very slightly and breathe through your lips like that. And then one other thing that you can do when you are breathing is when you are running and you're in normal breathing mode, take in as much air as you possibly can and breathe out as much air as you possibly can. That prevents large volumes of air from getting trapped in the lower part of the lungs. So you're not taking huge deep breaths while you're doing your heavy breathing, but when you're normal breathing, try to bring in as much air as possible and exhale as much air as possible. Those breathing practices may help you to eliminate the side stitch or to lessen the effect or lessen the frequency of the side stitch. Inadequate warm-up is another contributing factor to the side stitch. Think about it. We've all done it. You're excited to get out for a run, or maybe you're running a little bit late and you don't do as much of a warm-up as you should, and you get out there, you start running a little bit too intense in the beginning and you start to get the stitch. So you want to make sure that you're warmed up. Prepare your body for whatever activity that you're going to be doing. The warm-up is key in preventing injuries, and it's key in preventing the side stitch. The diaphragm is just like any other muscle. It needs to be warmed up, especially if the weather is colder. You want to do an extensive warm-up. Now, it doesn't have to be super long, but it has to be thorough while you are getting the body prepared for whatever activity that you're going to be doing. Now, you think about what you want to do. You do your warm-up, you get the blood flowing to the muscles, you get the synovial fluid moving around in the joints, and you get the breathing, you get the heart pumping, you get the air coming in and out of the lungs, and you get the diaphragm moving. Just like I said, the diaphragm is just like any other muscle. If you're on a timed run, then do a pre-run so that you're doing that slower run first, so that when the timer starts, your body is warmed up, your diaphragm is prepared, your lungs are prepared, your heart is prepared, and you can get out and run at the intensity that you want to run at. So make sure that you warm up before your exercise. It will help you to eliminate the side stitch, or to lessen the frequency or intensity of the side stitch. Nerve impingement is the next contributing factor that I'm going to speak about. As a doctor of chiropractic, one of the things that I do in my office is I use the chiropractic adjustment to help to optimize nerve flow, to help the skeleton to reestablish that proper motion and to lessen nerve impingement. And this is extremely important when we're speaking about the side stitch, because nerve impingement can lead to muscle spasms, it can lead to muscle weakness. The diaphragm, I've spoken a lot about the diaphragm today, but the diaphragm is innervated by the phrenic nerves. Now, what is so fascinating about the phrenic nerve is that the diaphragm is located in the lower part of the rib cage, but the phrenic nerves branch off spinal nerve roots up in the neck. The phrenic nerve branches off spinal nerve roots that come from the neck. They travel down on both sides through the chest cavity and innervate the diaphragm. So what we want to do, if I have someone who's coming in and they're suffering, they're telling me about the side stitch, I want to look at the neck and I want to lessen nerve impingement in the neck. I'm going to reestablish proper skeletal motion through the chiropractic adjustment, which is going to help to optimize the nerve flow going from the neck down to the diaphragm and back up. The next contributing factor for the side stitch that I want to speak about is your running spinal posture. And what I mean by that is I will see a lot of people when they run, especially when they get fatigued, they start to hunch over, okay? The thoracic spine starts to bend forward, the shoulders start to come forward. This is a terrible posture position for anything, for when we're sitting, for when we're standing, but especially when we are running or when we are moving. Because when we are in this position, look at my shoulders, look at my rib cage. My rib cage cannot move the way that it should. So this posture is preventing proper upper body motion, and it's preventing the rib cage from moving the way that it should. So we want to work very hard when we are doing our cross training to prevent this posture from occurring. This is what's called upper cross syndrome, meaning that the muscles in the front, the chest muscles, the pec minor, the pec major, the latissimus dorsi muscles, which attach in the front, the subscapularis attaches to the front, and the serratus anterior. I had spoke about that muscle before. The serratus anterior, that starts over here and attaches to the front, but they all pull the spine forward or they pull the shoulders forward. So we want to stretch those muscles, and we want to strengthen the muscles in the back, strengthen the muscles that pull the shoulder blades backwards. Those are called the scapular retractors. Strengthen the rotator cuff muscles. Strengthen the thoracic spine muscles, the muscles that keep us upright, so that you are running in a better spinal posture. This will help you to have better conditioning overall, have better posture, have better motion, and will help you to prevent the side stitch. So strengthen the muscles that straighten the spine, the muscles in the thoracic spine, strengthen the muscles that pull the shoulder blades backwards, strengthen the rotator cuff muscles that pull the shoulders backwards, and stretch the muscles in the front. This is what I spoke about, the serratus anterior muscles. The serratus anterior muscle, they do this. They pull that shoulder blade forward. So if they are tight and they are pulling us forward, we are going to be in a bad posture. So we want to stretch the serratus anterior muscle and stretch the pectoralis minor and the pectoralis major muscles. That is going to help improve our posture, help to combat the upper cross syndrome, and also help to prevent the side stitch. The last contributing factor that I'm going to speak about is the pre-exercise or pre-workout, pre-run meal, or our nutrition overall. This is probably the most frustrating of all the contributing factors, and this is the one that we've all been guilty of, and this is the contributing factor that gets most of the experienced runners, that gives most of them the side stitch. That's why it's so frustrating, okay? First of all, you have to realize that you cannot eat a heavy meal before you exercise. Meals that are high in fat, meals that are high in protein, meals that are high in calories, yes, they may be beneficial for us in most instances, but before our training, those meals are not, because they take a long time to digest. So the abdominal area is going to be full and it's going to be heavy. So that can contribute to the side stitch. Also, when we start to exercise, the blood is flowing to the muscles. And so the food that's being digested in the digestive system, it's not moving. So it starts sitting in there. So that contributes to the side stitch. So you have to prepare ahead of time. You have to figure out what works best for you. Also, with the drinking water during your training or before your training, do not chug large amounts of water. We all need to stay hydrated. We all need our water, but you don't want to until the race is done. Take small sips of water before you train and during your training or during your competition. Enough to keep you hydrated, enough to work for you, but you don't want to do too much. You don't want to chug and have that large amount of water sitting inside your gut. What you want to do, this is something I recommend for everybody, is keep a nutritional notebook / dietary journal, whatever you want to call it. Write down everything that you eat. Write down the amounts. Write down how you prepared it, the combination of foods, the time that you ate, and then write down how you felt afterwards and how you felt while you were training and how you felt while you were competing. Keep this journal for as long as you possibly can. The notes that you get, the feedback that you get from this will help you to develop dietary strategies that work for you. And you will get such good information when you keep the dietary journal. So do yourself a big favor. Keep a training journal and keep a dietary journal and figure out what nutritional strategies work best for you. All right, so we went over a lot of the contributing factors to the side stitch. Like I said, the side stitch, this is a frustrating condition because it is preventable and it is manageable. So what I want to do now is talk about what happens if you do get the side stitch. Say, just for example, you're out for a run and you start to get the stitch. You start feeling that pain down in here and you think, this is so frustrating. There's several things that you can do. Okay, first of all, you could slow down your pace a little bit. That is usually something that will help you. Okay, a lot of folks, maybe they don't want to do that, but you may have to do that. The next thing that you want to do is take your fingers, slide it underneath the rib cage, wherever you feel the pain at. Okay, if it's over here on the left-hand side, slide the fingers underneath the rib cage and do some massage in that area. Loosen up the muscles, loosen up the diaphragm. It will help to reduce some of that muscle spasm. And then also you can bend towards the opposite side. Say you're getting a stitch on this side, you're doing a massage, and you just bend to the opposite side a little bit. You're going to stretch this muscle, and if you're massaging it, it may allow you to get in there a little bit deeper and break up some of that muscle spasm. Also, you want to try to breathe a little bit slower and a little bit deeper if you're getting the side stitch. That may also help you. So use these three things, these factors, to help you, these tools to help you to manage the side stitch. Just be very smart, okay? We all know what the side stitch feels like. If it's not the side stitch, if it's something else, then you want to be very cautious. If it's a side stitch, massage those muscles, bend to the opposite side, slow down if you need to, change your breathing, breathe in slower, breathe out slower, breathe a little bit deeper. That should help you to manage the side stitch. Thanks everybody for viewing today's episode of Dr. Ozello's Sports Medicine Report. Like I said, the side stitch, it's not an injury, it's not an illness, but it is a frustrating condition. So do everything you can to eliminate the contributing factors that I spoke about. And also, if you have feedback or if you have suggestions that other athletes can use, please put them in the comments section below. That will help so many people. If you have done something that I have not mentioned, please write it in the comment section below and help out your fellow athletes. That will be something that is extremely beneficial to a large number of trainees. But again, thank you very much for watching today's episode of Dr. Ozello's Sports Medicine Report. Please feel free to like this video. Also, if you have questions, feedback, or suggestions, please feel free to leave them in the comments section below. Please subscribe to my YouTube page. Dr. Donald A Ozello DC is the name of my page. Always remember to train hard, train smart, stay injury-free, and accomplish your goals. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. There is actually a chapter in my book about the side stitch, chapter 28, page 142. You can get additional information on the side stitch that I may not have covered on this video. Thank you again for viewing today's episode of Dr. Ozello's Sports Medicine Report, and please remember, train hard, train smart, stay injury-free, and accomplish your goals.